I am super excited because we are talking about a very important topic. We are discussing contraceptives. What are contraceptives? What are the long-term effects of contraceptives? Is it good to be on contraceptives as a young lady? This and many more questions we will be finding answers to from Dr. Amoah. Before we begin the interview, a very big thank you to Mustard Health System for making it possible for us to use their facility. Welcome, Doctor.
Thank you very much.
And thank you very much for giving us this opportunity.
Thank you very much.
As we said earlier on, we are discussing contraceptives. It seems these days, a lot of young ladies have taken up to contraceptives. A lot of them use contraceptives without knowing the side effects of contraceptives. That is why we are here today to have a very short interview with you, for you to educate the youth on contraceptives.
Okay.
Yes. So to begin with, what really are contraceptives?
So contraceptives are what we call birth control methods.
Oh, okay.
So if somebody wants to either prevent pregnancy or space their pregnancies, we use contraceptives as a way to manage your childbirth potentials, or even manage a number of families that you want to have.
Okay.
So there are a number of methods that we use for contraception. What it is that every woman has a menstrual cycle.
Okay.
And it's the hormones that determine when the menses comes, when you can get pregnant, and the rest. So there are some contraceptives that will interrupt those hormones. So if those hormones are interrupted, your menstrual cycle will also be interrupted, and so getting pregnant will be near to impossible.
Okay.
There are others that we use, we call barrier methods.
Okay.
So barrier methods are to prevent the sperm from meeting the egg. So examples, condom. We used to have shampoos.
Wow.
We used to have shampoos where the woman will use in the vagina, and that will kill the sperms before they get to the uterus. They are also part of the barrier methods. There are very traditional ways, what we call coitus interruptus. So if the person, you are having sexual intercourse, before the man will release into the woman, the man will pull out the penis out of the vagina to prevent the sperm from getting into the vagina. That's also a method of contraception.
Okay.
Yes, so these are basically barrier method, hormonal, we call it hormonal method, and then the coitus interruptus. These are the basic methods of contraception that we have. And as I said, they are all birth control methods. Yeah.
Okay. So as we said earlier on, it seems a lot of youth have taken up to contraceptives. Does it have any effect on them? You see a young lady about 16 years, 14 years, who are on birth control pills. Does it have any effect on them?
So depending on which method you use. For example, if you use the barrier method, one of the most common barrier methods that we have is condoms.
Okay.
Then the effects on you is next to zero, because you can reverse it anytime you want. In fact, if you don't want to use it, you just don't use it at the time that you are having the intercourse. The shampoo 1, 2, the effects are very localized. You get the effects where you use it. So some people were reacting to it basically.
Okay.
But the ones that commonly used now are the hormonal methods, and those ones are the ones that will interrupt your hormonal cycles. It's been used for a very long time, and we use it for various reasons. Apart from birth control, we use it for various. The effects are all reversible.
Okay.
They are, all of them are reversible. So anytime you don't want to use it, just stop using it, and then all your hormones will get back to what it used to be. So we don't really have any effect that is, I don't know the word to use, but that is debilitating to the individual, because the effects that you have are all reversible.
Oh, okay.
What I'll say is that there are a few complications, rather, that will be a few complications, but those complications are even reversible. Once you stop using them, those effects will also be reversed.
Oh, okay,
yes.
so it doesn't determine as to whether the person will be able to give birth in the near future or not.
Not at all. So anytime you take a decision to have children, you stop.
Oh, okay.
So once you stop, you wait for a while, your menses will reverse back to what it is, and then you can have your children as much as you want.
Okay, but some people are on birth control pills but are still getting pregnant. So how does that also happen?
So, for example, the common birth controls that we know are the oral ones.
Okay.
Secure, Lydia, and those ones. Now, if you take those ones, you're supposed to take it once every day.
Okay.
Somebody may forget. So if you forget to take it and then you have unprotected sexual intercourse, the probability that you get pregnant is high. So that is one thing.
Okay.
I've also seen people who use emergency contraceptives as their main contraception, and that is wrong. Because the emergency one is such that if you are on one method of contraception and for one reason or the other you forget, for example, to take, and you have unprotected sex, it means that the probability of you getting pregnant is high. Then you use the emergency contraceptives whilst you continue with your regular contraceptives in which you are on. So if you don't use it well, because as I said, its effect is reversible. So once you don't take it, it will reverse back to your normal pre-contraceptive period, and then the chances of getting pregnant then will be high.
Okay.
Another method, condom, we say is user dependent. So the user must use it well. So if you don't use it well, it may be removed whilst you are engaged in the intercourse, and in that case, that barrier that is supposed to be created for the sperm not to meet the egg will be broken. And then you can get pregnant. So it's more of the user using it appropriately, and then the effects will not be affected.
But over the years, people have also complained about they not having their normal menses because
of their contraception. Okay, so the mechanism is supposed to interrupt your menses. So it is supposed to interrupt your menses. What is done is that you are giving you hormones that tell your body that, the cycle, the body responds to some hormones that the body produces. So estrogens, progesterones are produced by your body at particular times of your cycle, and that tells your body to do a certain activity for your menses to come. We interrupt that. So it's as if we are giving you the hormone to tell the body that this is enough, so don't come in. So the contraceptives, if it's either the injectables or the oral ones that you are giving, is to interrupt that cycle, so your menses will be interrupted. That is the normal mechanism of the contraception. So if your menses does not come, that is the effect of the contraception. So you shouldn't be worried.
And so it's normal.
In fact, that is what we are expecting. So if it doesn't come, it is the effect of the drug. So you should not be worried. It means that the drug is quite effective. And
does that in any way not contribute to fibroids?
Not at all. That has absolutely nothing to do with fibroid. It has nothing to do with fibroid. In fact, if you look at the risk factors for fibroid, contraception is not one of them. So it's basically being a woman, being a black woman. Because fibroid is seen more commonly in black women than in Caucasians. So being black and being a woman is the biggest risk factor for fibroids, and has nothing to do with the contraception. All right.
Does contraceptives in any way enhance weight gain? Because a lot of women complain that after they had taken the injectables and stuff, they tend to gain enough weight.
Yes, in fact, it's one of the side effects of contraception, especially the hormonal ones, the injectables. One of the side effects is weight gain. So it depends on what you think about the weight gain. It's like you are just robbing Peter to pay Paul, more or less. So if the weight gain is a border, then we can switch you to another method of contraception.
Oh, okay.
You know, because as I said, the contraception is not only the injectable and the oral ones. There are barrier methods. There are corrective interruptives. Those ones are all there. In fact, there's one that I forgot about. We call it IUD. We will put a material into your womb, and then it will interrupt any pregnancy that may come in. We call it IUD. It can be in your womb for 10 years. It's also contraception.
Yeah, and then with the IUD, we've heard, we have seen quite a number of people complaining that after they had that IUD had been inserted, they got pregnant, and then some of the babies will come holding.
Yes.
How true is that?
Yes, the IUD. That's happened. Yes, it's one of the downsides of it, but it's quite effective for a lot of people. Okay. So it's very easy to insert and very easy to remove. So if you have any issues with some people who have lower abdominal pain and those people who have abnormal bleeding, if those ones are a bother to you, we just remove it and change you to another form of contraception.
Okay. Yes. And is it in any way not cancerous?
Not at all.
Especially the metal stuff?
Not at all. I mean, it's been used over the years and it hasn't been shown to cause any form of cancer, no.
Okay.
Yes, as I said, it can be there for a decade.
Oh, okay.
Yes, and what is very highly reversible. Anytime you change your mind, you just move it and you come back to your contraception position.
All right.
Yeah.
All right. So are there contraceptives for men?
Yes, there are contraceptives for men.
But it's like in Ghana, I would say in Ghana because I don't know of other parts of the world. But it seems in Ghana the men are not so much interested in taking the condoms. Aside the condoms. aside the condoms, are there any form of contraceptives for men?
You see, because the hormonal contraceptives are quite effective for women. We haven't developed a lot of contraceptions for men in terms of the hormonal one. The female ones are quite common. Probably the reason being that they were using those hormones for other diseases. And then it was roped in as contraceptives. But you can do condoms for men, which is also very, very effective. Condoms for men. We used to have the shampoo.
Excuse me, Doc. We've heard that some men used the condoms, but they were still able to get women pregnant.
That's what I'm saying. So it's user dependent.
Okay.
So the user must know how to use it appropriately. Otherwise.
And we have also heard that some men can also go for injections, and then so that their sperms will be less effective or something.
Not that I know of, but in fact, probably what can be done. But you see, those hormones are drugs that we use for other forms of diseases, and the side effects of those hormones are that, in fact, what it does is not your sperm, but it affects your ability to erect.
Oh, okay.
So then, if you don't erect, then you will not be able to penetrate.
Okay, so
but we don't use it routinely as a form of contraception for men. And I think for men, it's more of the condoms. But remember, there's what we call, the tube in which your sperm passes, we can go and tie it.
For the men?
For men.
Okay.
But just that one is a permanent form of contraception.
Okay.
Because when we do that, we can't reverse it.
Okay.
So for men, it's mainly the condoms. Yes.
So there are no other contraceptives for men?
Not commonly used for men, no.
Aside the condoms?
Yes.
Okay.
Men will use condoms.
Okay.
as simple as the word men.
Okay, so Doc, I think, do you have any other thing to say about contraceptives?
Yes, I mean, as I said, it's a birth control method. It's a method to prevent unwanted pregnancies. Because If the pregnancy become unwanted, then the issues of termination, issues of abortion, and its complexities will all arise, costs, complications, and the rest. So, if a woman or a group of people cannot abstain from sexual intercourse, abstinence is also a form of contraception. If abstinence is difficult, then what we recommend is one form of contraception or another to prevent unwanted pregnancies. Because once unwanted pregnancies come, the issues are just too many to handle. So I would highly recommend that people rather resort to contraception to prevent unwanted pregnancy. And there are so many of them. You can choose from one method to the other. Health professionals are available to provide you with the support that any young person needs, and will help you to choose the right contraception that is good for you. So you don't use one contraceptive for everybody. Personalized, each person and what will work for you. So if you seek health care, we will give you what is good for you.
Okay, so there are no long-term long-term effects of using contraceptives.
Not at all.
And then a young lady, let's say a young girl, a 14-year-old girl, a 13-year-old girl, using contraceptives wouldn't have any effect on their womb or whatsoever.
Not at all.
Not at all.
It's just a birth control method. Anytime you want to stop it, you stop. And then you come back to your pre-pregnancy levels. Yes.
Okay.
Yes.
Okay. I think we will draw the curtains here. Thank you very much for giving us this opportunity. I hope you have learned a lot from today's interview. If you haven't subscribed to our channel, I will please ask you to hit the bell notification button so that anytime we drop anything, you will be the first person to get notified. If you haven't subscribed, please do, as we promise to treat you to more educative and entertaining stuffs. You have been watching me, Nanama Sechiwa Ansa, with Dr. Amoah, who is the
Director of Mastered Health Systems.
Who is the director of Mastered
It's a fertility
Health
and a urology center.
So thank you very much. I'll catch you sometime. Bye-bye. A very big thank you to Mastered Health System for the support given us. Mastered Health System is located at Newtown in Kansajan Junction.